All right, let's review some practice questions related to medications that you will see within our maternity section within the course. As with all of our practice question videos, I do ask that you pause the video after we initially review the question and the answer options. That way you can use your knowledge base to come to the correct answer independently, and then you can resume the video. That way we can review the answer and the rationale together. All right, we have a multiple response select all that apply, testing knowledge of physiological integrity. The labor and delivery nurse is caring for a patient who is at 40 weeks gestation and receiving IV oxytocin for the induction of labor. Which of the following assessment findings should cause the nurse to immediately discontinue the oxytocin infusion? Select all that apply. So which of these assessment findings is going to cause the nurse to immediately discontinue the oxytocin infusion? All right, so the correct answers are uterine hyperstimulation and late decelerations of the fetal heart rate. So oxytocin stimulates uterine contractions, and it's a pharmacological method to induce labor. So late decelerations, which is a non-reassuring fetal heart rate pattern, it's a very ominous sign of indicating fetal distress. So an oxytocin infusion must be stopped when any signs of uterine hyperstimulation, late decelerations, or any other adverse effects occur. So some obstetricians will prescribe the administration of oxytocin in 10-minute pulsed infusions rather than in a continuous infusion. So this pulsed method is reported to be more effective for labor induction, and it requires significantly less oxytocin use. Fatigue and drowsiness are likely just caused by the labor experience in general, and early decelerations of the fetal heart rate are a reassuring sign and do not indicate fetal distress. All right, we have a highlight in text style question testing knowledge of physiological integrity. The nurse is caring for a female patient at 32 weeks gestation who presented to the emergency department with complaints of a persistent, severe headache, blurry vision, and lower extremity edema. The patient was admitted to the labor and delivery observation unit with a diagnosis of preeclampsia. The patient has been prescribed mag sulfate for management of the condition. Upon initial assessment, the nurse notes the following. So there's a 3+ proteinuria, respiration rate is 11, BP is 92/50. There's a presence of deep tendon reflexes. The patient has a urine output of 20 mLs per hour, and the serum magnesium level is 6. So I want you to highlight the findings that are of immediate concern to the nurse. All right, so the nurse would recognize that this patient is presenting with magnesium toxicity. So signs of magnesium sulfate toxicity relate to the central nervous system, depressant effects of the medication. So signs of that toxicity include respiratory depression, a loss of deep tendon reflexes, and a sudden decline in fetal heart rate and maternal heart rate and blood pressure. So a respiratory rate below 12 is a sign of toxicity. The urine output should be at least 20 to 30 mLs per hour. A proteinuria is an expected finding in a patient with preeclampsia. Also, the presence of deep tendon reflexes is a normal and expected finding. And then you need to recognize and know that therapeutic serum magnesium levels are 4 to 7.5. Also, very important to always know your antidotes for all medications. Your antidote for magnesium is that of calcium gluconate. All right, a classic multiple choice. A 28-year-old pregnant female is at 28 weeks gestation and presents to the emergency department with complaints of contractions that are increasing in frequency and intensity. And she's also having a sense of pelvic pressure. After exam by the on-call physician, the patient is noted to have cervical dilation and effacement. The nurse anticipates the administration of which of the following for fetal lung maturation? So this is a very simple question, but yet it's very important for you to know. So which of these medications is the nurse going to give to try to increase or speed up the maturation of the fetus's lungs? The correct answer is betamethasone. So betamethasone is a glucocorticoid, and it's given to increase the production of surfactant to stimulate fetal lung maturation. So it's usually administered to patients in preterm labor anywhere from 28 to 32 weeks of gestation, if that labor can be inhibited for up to 48 hours. All right, another highlight in text style question testing knowledge of physiological integrity. The nurse is caring for a 32-year-old mother who just gave vaginal birth to a healthy newborn. The mother is experiencing heavy vaginal bleeding with the passage of clots and is determined to have a postpartum hemorrhage. Upon chart review, the nurse notes the following. The mother does have a history of hypertension. The blood pressure is currently 158/90, heart rate is 98, respiration rate is 18. The physician has ordered methyllergonavine, and the patient's experiencing excessive lochia. So I want you to highlight the findings that are of immediate concern to you as the nurse in caring for this patient right now. All right, so the past medical history of hypertension, the elevated BP of 158/90, and the physician order for the methyllergonavine are of immediate concern to the nurse. So this medication is used to prevent or control postpartum hemorrhage by contracting the uterus. However, in causing the continuous uterine contraction, it can also elevate the patient's blood pressure. So a priority assessment before the administration of this medication is to check the blood pressure, and you always want to notify the physician if hypertension is present. All right, a classic multiple choice assessing knowledge of physiological integrity. Which of the following statements made by the patient who is Rh negative and pregnant indicates a need for further teaching regarding the administration of Rh immune globulin? So which statement indicates a need for further teaching? Meaning which of these statements is false or inaccurate regarding the administration of Rh immunoglobulin? All right, and the correct answer is I do not need Rh immunoglobulin if my baby is also Rh negative. So Rh immunoglobulin is given to Rh negative women during pregnancy to prevent the development of an Rh isoimmunization. So this can occur if the woman is exposed to Rh positive fetal blood during pregnancy or delivery, which can lead to the production of antibodies that can harm future pregnancies. So therefore, all Rh negative women should receive the Rh immunoglobulin regardless of the Rh status of their baby.